Going to go into a session now around managing the side effects of pH treatments. Excited to have a couple of amazing medical professionals here who are going to answer every single question you could possibly have with 100% accuracy. Similar format to what we've seen all day. Going to have around a sort of 30-minute presentation, then we'll move to Q&A. Any questions on the line, please throw them into the questions or into the comments, and I'll collect those and ask them at the end. But I'm excited to introduce to you our two speakers, Kelly Gold and Dr. Krista Kemp.
Hello, everybody. Thank you for allowing Kelly and I to come today. It's really our privilege to be able to speak with you. We hope to bring you through some of the side effects, and as much as I'd like to say, I can give you 100% confidence that we're gonna get it all. I'm pretty sure I can't return that to you, but we'll certainly try our best. We both work in Moncton, New Brunswick, doing pulmonary hypertension at the clinic there, and between the two of us, we really strive to do our best. Whoops. Okay, a few disclosures for Kelly and I. We have received some funding from both Janssen and Merck, but it shouldn't affect the advice that we give you today. So as far as our objectives, Kelly and I are going to trade off a little bit during this presentation. We hope to address 6 different things. I'll target the first half and she'll target the second half. The first is really to understand the goals of pulmonary arterial hypertension therapy. We'd like to explain how the medications work and what might cause the side effects on account of that, explore what the symptoms are from the pulmonary hypertension and the medication side effects, because of course we can have both at the same time. Then we'll get into recognizing and managing what is considered to be normal and also abnormal, and review and discuss the management strategies to try and help with those side effects. And then last, we'll get into discussing how we can try and do personalized management for these different treatments. So I'd like to start with, if you are a pulmonary hypertension patient, can you raise your hand? Okay, now, keep your hand up. Give a little wave, no. If you've ever had a side effect from your medication, keep your hand up. Okay, look around. Right now, a lot of people in here aren't on the therapies, but you guys all kept your hands up, right? It's pretty ubiquitous having some form of side effect. So this is not an uncommon problem at all. Okay, so I'm a physician, and when I have a patient in front of me, what informs me to decide what I'm going to try and recommend to you as the best therapy is probably very different. What my goal for treating is, if I ask you as a patient, what do you hope to get out of this therapy? So Dr. Weatherall this morning had gone through a lot of clinical trials and explained how medications come to be approved and available for treatment for our condition. And there's a lot of science and rigor behind that, and when the trials are being made, there are certain endpoints that are being looked at, and those endpoints are a lot of those things that you see on there. A functional class assessment, an exercise capacity, so of course you all know when you come to clinic you can't wear sandals, you have to wear your running shoes because we're going to make you walk. And other things like hemodynamics that we'll do in our initial evaluation and maybe again in follow-up. And then we're going to look at the right heart function with either blood work, the BNP assessment, and possibly echocardiogram. All of those things come from the clinical trials because those were important endpoints. So if you ask me, I'm treating you with therapy, what is my goal? Well, my goal will be to improve your functional class, to improve your 6-minute walk distance, to decrease your BNP, to make sure your echo shows that your right heart is doing better, to improve your hemodynamics. Now, if I ask you, you're probably not going to say those exact things, but those things are important because they've been informed to us through what the outcomes of the clinical trials are. And in that flow sheet that we have there, that's the most recent algorithm that's available to us as treating physicians of what we decide to recommend to you as patients based on how you are. Now, of course, this is very, very current. So if you presented to my clinic, tomorrow, next week, we would consider using this. Now, this has been a work in progress. Of course, I started doing this 20 years ago, and there were really very few therapies. In fact, when I was still in my training, there was only IV epoprostenol. And in this last 20 plus years, we've had lots of new therapies, which is wonderful. It's wonderful for us as providers and also for you as patients, because we do have options for treatment. But treatment is becoming more complex because we have more options. And if you can see by that algorithm, people are not going to really be started on one therapy. It's usually several therapies, so we're talking about multiple side effects. So when you ask me, that's what I would say. When I ask you, what's important for the goal of care? Well, guess what? PHA Canada did ask you that, and it's available on their website in the Burden of Disease report. And 57% of you said, your most important goal for therapy is to improve your quality of life. But the other thing, too, when they were asking about it, 1 in 5 of the people who responded, 20%, said that, side effects were actually limiting your ability to have that quality of life because it was important. So side effects are really important. They affect you. And of course, as the hand suggested, I'm sure it's more than 20% where it really does make a big problem. So before we start talking about the side effects, we have to talk about the symptoms of the disease, right? So if all of you remember when you or your loved one showed up to clinic at the very first presentation, you probably weren't feeling well. Most people, when they present in functional class 3. They're not picked up early, and a few are also picked up very late in the disease course where symptoms are overwhelming, but most people will have a significant burden of symptoms at presentation. And of course, the therapies are meant to improve symptoms as well as improve all of those other markers and hopefully make you live longer. But you have to remember that the symptoms were there in the beginning, so there's going to be a little bit of a balancing effect. But overwhelmingly, the symptoms are going to be a lot of shortness of breath. Some people are going to have fluid in their ankles. Some people are going to have chest pains, palpitations. Some people might even be passing out. Some people may even be so sick that they end up in the intensive care unit. So these are important things to remember because we are trying to treat so those symptoms don't remain as prominent and ideally that they go away altogether. So we have many types of treatments. Of course, there's just what I'm going to call conventional therapies that are not specific to pulmonary arterial hypertension. So if people require oxygen, then that will be prescribed. That is a medication. Some people will require diuretics, so if there's a lot of extra fluid on board, they get the water pills to try and reduce that. Some people may require blood thinners, depending on what the background situation is. So those are more conventional therapies. You can even put immunizations in there because we are going to recommend those to people who are in the clinic every year. And then there are the PAH-specific therapies. Okay, so those are the medicines that were in those diagram that I just showed you, that flow sheet. So those can be administered by mouth. And then, of course, they can be administered parenterally. And what do we mean by that? They can either be subcutaneous, like subcutaneous Remodulin, and then the new medicine to sotatercept is a subcutaneous injection. And then there's the intravenous prostanoids, such as intravenous epoprostenol, intravenous treprostinil. So we have different types of treatments, and they're delivered in different types of ways. And then we also have just therapies. I mean, people don't only just have pulmonary hypertension. You're allowed to have the same medical problems as everybody else in the world has. So maybe there's some treatment for depression, or maybe there's a thyroid issue. Maybe somebody has low blood. So there's other medicines that people are getting at the same time. And we have to look at medicines as a whole because, you are not just one disease. You are a whole person. And then the last things are things that we don't often think about when we're asking, when the nurse goes through your medication reconciliation at the clinic. There's things that you buy at the pharmacy, the supplements, if you're on vitamin D, for example, or some people take herbal supplements. So these are also things that are important because they can interact and they do have some influence on, what's going into your body and what may cause side effects. So this is a busy diagram. We saw this earlier today. So when we're talking about PAH-targeted therapies, which is really what the discussion in this session is about, we now have 4 different pathways, actually 5, I'll put the other one, but 4 for PAH-specific ones. So it's the endothelin pathway, the nitric oxide pathway, the prostacyclin pathway, and then the activin BNP pathway. And this little cartoon is the wall of the blood vessel. So obviously lots of chemicals talking to one another and proteins. And at the end of the day, when you have pulmonary hypertension, these blood vessels are constricting or like squeezing down, and the muscles are getting thicker. We've seen that with some of the diagrams earlier, and making it hard for blood to flow through them. So these therapies, what they're doing is they're trying to undo those changes. So the bottom part, the first three categories, which is the categories effectively that are available for therapy right now, they're supposed to really try to relax the blood vessels. And important to remember that, because the side effects, we're taking these medicines either by mouth or under the skin, and it's not just going to the blood vessels in our lungs, it's going to all of our blood vessels. So a lot of the side effects relate to that. And then the newest one, the activin pathway, which would be for sotatercept, it's really trying to rebalance. And again, Dr. Weatherald spoke about that earlier today. So just really understanding where these targets are, I think it makes it a little bit easier to understand why those side effects are happening, because those targets are not limited to the circulation in our lungs. It can go everywhere. So this is a table from this most recent updated statement from the World Meeting recently. So these are just the different classes of medicines again, and I'm not going to go through all the side effects here because I don't want to steal Kelly's thunder, because that's what she's going to be speaking a little bit more on. But the first two there are the nitric oxide medicines, so the PDE5s and the guanyl cyclase inhibitors. And as you can see, the side effects for them include things like headache, flushing, heartburn, and can have some nosebleeds, nose running, and then in the cyclic GMP one, also you can have low blood pressure, and again, because it's affecting our blood vessels everywhere, including our regular blood pressure. Some important things to know. We'll get into this again a little bit more in depth as we go. Other things that aren't necessarily side effects for some of them, but like, for example, if anybody was in the Mythbusters earlier today, we're talking about how there can be a critical drug interaction with nitroglycerin or nitrates. And of course, those two therapies, those two classes cannot be used at the same time. As far as the endothelin receptor antagonist, you can get some swelling in your lower extremities, you can get that nasal congestion, and some people might have low blood, which is why we need to do some blood work after people start on these therapies. And then if we get into the prostacyclin ones, which would be like selexipag, and then the IV ones, the parenteral ones, these have a larger burden of side effects. And again, Kelly's going to spend some extra time talking about that, because for sure they're going to give side effects. And we know that. That's why we gradually increase the medicines. So it gives you some time to get used to it before we give more of it, to really find that balance, so we can really, again, it's that balancing act of you have all these symptoms from pulmonary hypertension, and usually if you're going on an intravenous prostacyclin or a subcutaneous prostacyclin, you probably have quite severe symptoms, so we really want to alleviate those. So it's really about trying to find that middle ground. And then, of course, the last class of medications that we have, the new one, sotatercept, we talked a little bit about the side effects again this morning during the plenary. You can have things with, like, bleeding is one of the bigger ones, okay? So just sort of recapping what I was saying, well, how do these work? Really, the whole point of getting these therapies is to treat your pulmonary arterial hypertension, including the symptoms. We want to have the blood vessels to relax so that there's better blood flow. As a result of the decreased stress on the whole system, the heart is able to pump more easily. And as a result of that, hopefully you can feel better, you can do more, and have an improvement in your disease so that you have better outcomes in the long term. Some of the big side effects that Kelly's going to touch on, you can see here. She's going to spend a lot of time talking about them, so I'm not going to go through them right now. But the last slide I'm going to leave you with before I shift it over to Kelly is to really understand that this is a bit of a delicate balancing act, right? Sometimes, and I love it when it's straightforward for patients. They don't have too many symptoms and they feel better. That's obviously what we want. But some people are going to have side effects. So it's really trying to find that balance. Do we need to kind of not do things so quickly if we're in the middle of a titration, or if there's really poor intolerance? Are we going to just give it a little bit of a pause and then maybe later add it in when things have kind of settled out a little bit better? So it's all these nuances. So I'm going to hand it over to Kelly. She's going to really talk about all the nitty-gritty that you need to know.
Is this working? Oh, I have a microphone in my hand. Watch out. All right, so we're going to break these down by drug. We're talking about the common side effects. So if you were to look up these medications, these would be the common side effects that you would see. So a lot of them are the same. From the other slides, you can see that. So how I broke it down is I won't repeat the same side effects for every drug, but I'm going to tease out some of the ones that are kind of different. So first we'll start with calcium channel blockers. There's some names up there that you may recognize. Remember that people who take calcium channel blockers, where pH is rare, they're even more rare. So there are real rare birds. It's a very, 10%? 10% that use calcium channel blockers. Of idiopathic pulmonary hypertension. So what are the main ones? Well, this is the little summary. I'm going to break it out. So number one is flushing, right? Because we're dilating, we're vasodilating everything. It's not just our lungs, it's not just our arteries. So some flushing. So we recommend, I'm having hot flashes now, so I completely understand how this feels, right? So you want to stay away from hot humid places. You want to dress in layers, right? Somebody even said buy one of those little personal fans from the dollar store, right? And be cautious with alcohol, because sometimes that'll make you, just the regular folk flush sometimes. So just be cautious with that. And everybody's different when it comes to that. Next is heartburn. So there's lots of acid-reducing medications that you can get over the counter, or you can even speak to your family doctor about if you're really suffering from it. One of the good things that you should probably do, though, is watch or have some insight into what you're eating. Because maybe it's changing things down there, and maybe things you could tolerate before you might not be able to tolerate now. So maybe when you first start out on these medications, if you're suffering from that, maybe keep a little food diary and see, what's bothering me, what's not. And then most drugs, the pharmacist will tell you, or the support program will tell you whether you can take them with or without food. Most of our drugs, it doesn't matter. And sometimes if you do experience heartburn, try it maybe without food, or maybe try it with a little bit of food to see if it makes a difference. So when it comes to calcium channel blockers, very common that people get swelling, but it's not the worrisome swelling that we worry about in pH. It's more called cosmetic swelling, and it's just because we're relaxing those vessels in the legs. And I'll tell you that most of my patients on calcium channel blockers, this is what bothers them the most. So you can use some support socks, compression socks to help with that, elevate your feet. Exercise is also very good too, because we want to keep that circulation going so we have that good blood return back to the heart. Dizziness, so of course it's going to cause low blood pressure. So with dizziness, just remember, watch position changes, right? Because your body's now being chemically altered by these medications. So when you change your position, there's a bit of delay in your sensors to regulate your blood pressure. So be careful getting out of bed in the morning, jumping out of a chair, anything like that. Also, a lot of times too, people have a history and they come to see us, maybe they've been treated with heart rate medications or blood pressure medications, so sometimes we have to see what you're on. Otherwise, we might have to change that blood pressure medication or go down in doses. The other thing too is to be mindful of your hydration status. So when you come to see us in the pH clinic, we read you the Riot Act about fluid and salt, and then some people don't drink anything at all. So if you're dehydrated and we're also, dilating those vessels and lowering your blood pressure, you're going to be dizzy if you're dehydrated. So be mindful of that as well. And medication timing. So sometimes we can play around with doses too. Sometimes it's recommended maybe you're going to take it at night instead of in the morning if it really is bothersome. And low heart rate specific with this one, this can lower your heart rate. If this is a problem and you're feeling dizzy or nauseous, all this kind of stuff, speak to your doctor. There's some other versions of this drug that we can give you that won't affect your heart rate quite as much. So just keep that open dialogue. So moving right along. So we have the PD5 inhibitors, and we also have the SGC stimulators. We're going to put them all in one class. And I have both names up there so everybody can recognize if you're on that one. So once again, same kind of side effects, flushing, dizziness, headache, heartburn. But this one we're going to add some muscle aches, we're going to add some nasal congestion, and possibly there's some rare side effects that can be some vision changes. So we're going to tease those out. Again, this is the low blood pressure, again, a little bit different than the calcium channel blocker. okay? So once again, be careful with position changes, might have to adjust those other blood pressure medications, your hydration status, and again, your medication timing. Headache, a lot of people complain of headache. So we always will suggest Tylenol is the drug of choice for this. We want you to stay away from the non-steroidal anti-inflammatories, and those would be like ibuprofen, Motrin, Aleve, those kind of medications. We don't generally like those medications just because it can affect your blood pressure. It also can cause bleeding as well, so we got to be really careful with those. A lot of times when I tell somebody to take Tylenol, I kind of get the Tylenol doesn't do anything for me kind of business going on. And a lot of people don't understand that Tylenol, you have to take a couple doses to get it to work. Okay, so if you're having some muscle aches, which we're going to get to, or some chronic headaches, you have to take it regularly. It builds on itself because it works in those pathways. Some other things on here, caffeine, just in small amounts for some people, caffeine, because anybody who maybe goes without their coffee someday might get a headache, so it does have some effect on headaches. Natural products like peppermint oil, and treat early. Like I said, if you know a medication is going to give you a headache, maybe take that Tylenol before you take it. Okay, try to prevent it a little bit. And once again, medication timing. If it does, maybe you can take it in the evening, and you'll be sleeping through it. Muscle aches, once again, Tylenol is great for that. Massage, heat, and stretching. Also activity. I know, what is she talking about? I'm sorry, I don't want to do any activity. But it's important to keep those muscles conditioned, and it can actually help with some of those muscle aches and pains. Nasal congestion is another one. Looks like my thing's running into each other. We really recommend against any decongestant sprays. So some saline spray, you can get that over the counter, helps. Also note too, maybe you have seasonal allergies. Maybe it's not that. Could be other things that are causing that. And you can take some allergy medicine for that. And this one is a rare one, it's vision changes. We don't see it very often, but it can happen. And like Dr. Kemple always suggests, if you think something is changing with your vision, it's probably easier to actually get in and see your eye doctor than it is to come in and see us. So give us a call, let us know, but go ahead and make that appointment with your eye doctor. They can always refer you on to a specialist, maybe before we even get the ability to do that. So moving on to ERAs. Again, common side effects, swelling, headache, heartburn, nasal congestion, and blood work changes. So this swelling, I pulled this one out because it's not cosmetic. And a lot of people who start on ambrisentan specifically will develop that swelling. So we always will caution you about the salt and the fluid. You may need a diuretic to help control this as well. But it is a common side effect. We're just going to monitor it and to try to keep your feet up, when you're sitting, stuff like that. Monitor your weight. That's something you're taught in the PH clinic as well. We want you to weigh yourself every day. It's not because we're on a weight loss program or anything like that. It's just a great way to monitor your fluid status. And with this drug specifically, we're going to do some blood work too, depending on which version of this drug that you're on. Some of these drugs are metabolized in your liver and they can cause your liver enzymes to be elevated. If that is, we'll watch your blood work. And we have options in this category. We can always change the medication that you're on. So moving right along to those additional therapies. So when we talk about these additional therapies, usually they're a third therapy that we add. It's a little bit more intense. So once again, we're balancing that between what are the symptoms that we're trying to treat to give you better quality of life versus what are the side effects we're going to give you. And we have to find that nice balance. So initially, people are a little nervous about starting on these treatments because they're afraid of the side effects. But we're going to go through them. And just so you know, a lot of times they're more intense, but then as time goes on, they seem to settle. And then when we make dose increases, they come back. Over time, they're going to settle again. So we'll start with this bad boy right here. This is Selexpeg or Uptravi. Is there anybody on this medication that's here? Oh. So these ones, diarrhea is a big one for this. So we'll go through these: dizziness, headache, jaw pain's a new one that we're seeing in this category, nausea, vomiting, muscle pain, and fatigue. So probably the biggest complaint we have with this oral medication is that it does cause diarrhea. And this medication, we titrate it up. It's a twice daily medication, and we bump you up. And we go by your side effects is how we do it. So initially you start with diarrhea, and we do encourage, you can take Imodium, any kind of antidiarrheal medication. Fiber, believe it or not, makes a big difference too. That was a good tip I learned from my nursing friends. Sometimes Metamucil will help with that too. It just sort of bulk things up for you. Again, keep a food log. See what foods now bother you that maybe didn't before. Dizziness with this one, just a little bit more pronounced dizziness. And once again, it'll level off in your system as you go. As you get used to this medication, it should improve, but you do need to be careful initially with position changes. Don't get up too fast. Headache is another big complaint for this one, probably with the diarrhea. I would think the headache's the next one that really is bothersome to people. It's the same recommendations, but where we're titrating this medication up to know, like when I started on this medication, I did get some really bad headaches, I got some bad diarrhea, so maybe I'm gonna take some of these medications to help prevent, and so it won't be as intense when I'm going up on my dose. Jaw pain, usually it's with the first bite of food. It doesn't last all day. I actually read somewhere that chewing gum sometimes helps too, which I thought was really interesting. And of course, it bothers our stomach too. Sometimes we get some nausea, don't feel as good. Rarely I see vomiting, but it can happen. Again, there's over-the-counter medication for that. You can take, brand name is Gravol. There's also some ginger Gravol out there too. Regular ginger helps. You can get candied ginger sometimes at the bulk barn. That'll help settle your stomach as well. And again, that food log really helps. Muscle pain, like the other medications, a little bit more intense with this drug. Again, you can take Tylenol. We don't want that the Advil or anything like that. Don't take any of those non-steroidal anti-inflammatories. And stretching, and sometimes heat helps too. Fatigue is, so this one's tricky because pH can make you feel tired, right? And just everyday life can make you feel tired, right? So this one does make you feel tired as well. So I really encourage energy conservation, especially when we're starting the medication and we're titrating up. Save your energy for the things you want to do. Do you want to go to your son's baseball game tonight? Well, then don't clean the entire house today, right? Conserve that energy for the things that you enjoy until you start to feel better. And there's even things like, planning your meals ahead, letting your family know that you're making these dose increases and you're not going to be able to do some of the things that you usually can do until you get over the hump and start to feel better. And don't be afraid to ask for help, because people actually do want to help you. So these are our drugs that we use IV or subQ that we've talked a lot about today. And again, we bump these medications up, so those side effects become more intense as you go on. Same gang of side effects: diarrhea, dizziness, headache, jaw pain, nausea, vomiting, muscle pain, fatigue, and then we have the added site pain if you have the subQ version of it. So we'll stick with site pain. That's pretty much the one we're going to tease out of this one. And when we talk about Remodulin, specifically subQ Remodulin, people get really nervous because they hear this from other people. And we always tell people there's a lot we can do leading up to site changes, leading up to teaching you how to prep your site to get ready for that, to try to decrease some of that site pain. So there's some topical creams, there's anti-inflammatory creams we can use, hydrocortisone, there's a specific gel that the pharmacy can compound for you to help. There's steroid sprays, cold compresses. Securing your site really helps people when they're starting their Remodulin so that it doesn't move. Tylenol, of course, sometimes we have to go up a little higher and get some prescription pain medication to help you out. And sometimes we even tell you to pre-start your site with saline to kind of prep that area for your Remodulin. Usually the side effects last, some people it lasts 3 days, some people it lasts up to 10 days. And then usually once those side effects go away, you're usually good to go for several weeks before you have to have another site change. So this is the new kid in town that everybody wants to know about. Dr. Kemp and I have no experience with it. If anybody here has experience and wants to share that with us, we would really appreciate it. But this is sotatercept, and this is a subQ injection. So it looks like this is going to cause you some side effects as well, similar to other medications: dizziness, low blood pressure, flushing, headache, nausea, vomiting, fatigue. But it has a little bit of higher risk of bleeding. So you may have some nosebleeds. You may notice, I call it spider veins, you call it She pronounces the big words for me, that's why I bring her.
Telangiectasia.
But really, for people like me, it's like spider veins is what it is. And you can have them on the outside and you can have them on the inside. So the ones on the inside are the ones that we worry about. So we're going to want to watch you for bleeding. So do you have nosebleeds? Do you notice when you go to the bathroom, maybe you have some dark looking stool, you might want to get that looked at. But we're going to also check your blood work too. So this is a drug that they give every 3 weeks. And it's our job to keep an eye on your blood work as well. So we'll stay on top of that risk. But everything comes with risks, and bleeding tends to be the one that comes with this one. So watch yourself for bruising and bleeding, and I think I've gotten ahead of myself. So nosebleeds, humidity, blow your nose gently. Injection site reaction, although I've heard mixed reviews, it's just a once-a-week sub-Q injection. Some people said that it was, what am I saying?
Every 3 weeks.
Every 3 weeks. Sorry, every 3 weeks injection. And some people are sensitive to the injection, and some people it doesn't bother at all. And then there's that bruising, bleeding. So maybe some gum bleeding, so maybe don't be an aggressive toothbrusher. Get a soft toothbrush. Watch it when you're shaving. Maybe use an electric razor instead, just to prevent some of those nicks and cuts. I always suggest be careful going barefoot as well. If you're like me, you shove your toe into just about everything. And those spider veins, which we talked about. All right, I'll leave it to Dr. Kemp.
So that was great, Kelly explaining all the things. So there are some special considerations. These medicines that we're using, certainly they're supposed to be relaxing all of our blood vessels. Now there are two conditions that can get unmasked, and they look exactly like pulmonary arterial hypertension when we do the workup, and they're called pulmonary veno-occlusive disease and pulmonary capillary hemangiomatosis. And essentially, these diseases have narrowing of the blood vessels, but it's not in the small arteries. It's like in the veins. And when we relax all these arteries, all of a sudden, the fluid has nowhere to go. And people can go into what we call pulmonary edema, which is when the fluid all goes into the lungs. Now, this historically was happening more frequently when we were just using IV epoprostenol before we had all of these oral therapies, because the medicine is so potent and it works right away. So you sort of have this sudden amount of fluid that can go in the lung. We can still see it, of course, with our other therapies, especially since we're often starting with 2 therapies at once. So it's just something to be mindful of if again, maybe it won't apply so much to you guys because you're not new patients who are not started on any therapy yet, but it's important to just remember this if you are getting more out of breath, particularly if it's been relative to a new medication being added onto your therapy, for sure reach out to your care team because they will want to know. The other thing for women of childbearing age is some of these medicines can be harmful to an unborn baby. Of course, usually people of childbearing age, there will have been a discussion in the clinics about trying to avoid pregnancy because it is a very dangerous time on the heart in your body, and it can be, as a result, if your heart's not really as strong because of the stress of carrying another life in you, that it can be also harmful for the baby. So it is a tricky time, and we usually recommend against it, but some patients do choose to go through with pregnancy after a discussion with their clinic, and so some of these medicines cannot be taken safely due to the risk to the baby. The other thing that I just wanted to touch on that patients often forget about is all medicines can be a problem, and even if it's not technically a medicine the way you know it, right? Again, a lot of people will be on supplements, and some supplements might be fine. Like, for example, if you're on vitamin D, we probably won't get so upset, but some of these therapies, we don't know exactly what's in them. If it's a natural product, it doesn't have the same vigor and testing as ways it does if it's a prescription medicine. So it's just important to discuss both with your team and also maybe with the pharmacist, because the pharmacist also is a really good resource to understand, because some of these medicines or supplements can have stimulant type therapies in them, and we don't want that, right? It's not good to put extra pressure on your system. So just because it's natural doesn't mean that it's safe. So overall, it's really about trying to manage everything. We know there are going to be some side effects, but we also want to treat the disease. So So a lot of it is just making sure we plan for that. And at the end of the day, it will be a shared decision-making event, right? We're going to explain what the side effects of the different treatments are. Of course, if you're going to read from the big insert that you get with it, not everybody's going to get every single side effect. We certainly have people who do better than we ever would have expected on these therapies, and of course, they feel better too. So we are definitely here to support you and to do this in a very shared way. Just going to give the last little bit back to Kelly here.
Yeah. So we're going to squeeze the most important part in right now. So we talked about the science. So in medicine, we talk about the science of medicine or the science of nursing, and then we talk about the art of medicine and the art of nursing. So I'd like to sort of change this up. So we just talked about the science of pulmonary hypertension, and now we're going to talk about the art of pulmonary hypertension. So when it comes down to it, we can talk about side effects. We don't experience those side effects. You experience those side effects. So we want you to learn about yourself. We want you to do what works for you. That's the most important thing. You're the art of pH. So it says here, know your baseline and know the normal side effects. Know what are my pulmonary hypertension side effects? What are the normal side effects of this medication? And if you're outside the normal, you need to talk to us. We need to communicate about this. It may not be the medications. It may not be your pH, but we're going to help you tease that out, okay? Report sudden changes. Never stop your medication without telling us first. That's actually very, very dangerous. We want you to communicate with us. Be aware of other possible causes. Find what works for you. Be patient with yourself and your journey. And like I said, if you're making changes, if you're starting a new medication, communicate that to your loved ones so they can support you and help you. Allow your body to adjust to the side effects, because many times your body will adjust to it over time. Find support, communicate with loved ones. Conferences like this, finding people who are going through the same thing as you is just so very, very important. And be your own expert. And that's something that Dr. Kemp tells all our patients, that you are the expert in yourself. You're the expert when it comes to these medications. And you're the expert about how you feel and how you feel these medications are treating you. So to wrap it up, I always love this slide because we have great expectations, but we all know what reality looks like, so we need to be gentle on ourselves when we're trying to get through this journey. This is a quote from my favorite book, The Alchemist, and it says, "There is only one way to learn. It's through action. Everything you need to know, you have already learned through your journey." And here's some resources.
Yeah, so just a few resources. I mean, all of you guys already know that your teams are there to support you, and please reach out. And not to forget that your primary care provider, your other people will want to help you as well, because certainly they want to know the whole of you and help with you. Pulmonary Hypertension Association of Canada, I mean, that's why you guys are here today. They're very much there to support you. Last plug is for this. If you guys haven't downloaded this manual, it doesn't specifically address side effects, but it's a wonderful resource, so that's my plug for it. The last thing is thank you so much for coming today. It really means a lot to us that we can speak to you, and we look forward to your questions. We'll try and answer them our best.
Hello. Thank you very much. I'm going to jump straight into Q&A. There was a question online about seeing a specific slide. Just as a reminder, this is being recorded, and so you'll actually be able to review this session and all the slides that were presented. If there was a specific question, though, feel free to throw it in the chat, and I'll come back to it. But is there anything in the room? I'll run a microphone over to you so that it can be heard online.
So nobody here has side effects, no burning side effects that they're worried about? You guys have fabulous care teams then.
Oh, we did get one online, perfect. What are your thoughts on CBD and/or other cannabis products as aids for managing side effects?
I'll take that. So as you know, that's a bit of a gray area. There hasn't been a lot of research on the effect of cannabis, specifically with pulmonary hypertension. The great news is that in Canada it's legal, and they'll be able to do these kind of studies with people. I always tell people to be cautious with anything like that. You do you. You know, if you think it's safe for you, if it's something that you've done in the past, I wouldn't say pick it up as a new habit or anything like that. But when it comes to pain, like site pain or muscle aches, there's cannabis creams out there, right? There's nothing wrong with that. That's not going to hurt you. Of course, Dr. Kemp, who is a respirologist, will always tell you not to put anything into your lungs. That's not prescribed. We would always suggest that you don't smoke it specifically. But some people do use, and you know what? We have cannabis stores across the country. There's a well-educated staff there as well. If it's something that you're interested in, have that conversation. But don't forget to tell us. Don't forget to tell your healthcare team that you're using that as well. Don't be shy.
We have another one. Can you talk about heat versus cold for headaches or back pain? Why one over the other?
There really isn't one over the other. A lot of times people talk about heat for muscle pains because they think it's going to relax the muscle. There's actually new theory coming out that alternating hot and cold can actually be beneficial too. So I think it's just whatever works for you. Try the cold if that works. Try the heat if that works. Try both.
This is a very specific one, which thought was a mistype, but it's not. Aside from grapefruit and sildenafil, are there any other food interactions to be careful about?
I'm not aware of any specific food interactions, but this is something specifically, as far as the pulmonary hypertension medications themselves, you'll be discussing when we prescribe. There's also a support nurse and a team, but it's more the other things, right? So this is where your pharmacist can be helpful, or if you're really worried, ask us if something new is being started, and if we don't know, we may not know because we're not experts in all the other medications out there in the world, but certainly there are medicines that have lots of side effects. They do have drug interactions, and that's where a pharmacist can be key. Okay, so just to make sure that you ask if something new is being started. I think that's the most important question.
Oh, got you coming.
How do you determine if you're having a side effect, if it's caused by?
So the question is, how do you know if it's a side effect, if it's being caused by? Yeah, so a lot of it is being a detective, right? So the first question is, what's recently changed, right? So if you've recently had a change in your pulmonary hypertension medication, well, there's a good possibility it may be that. If you've recently, say, for example, had an infection and you had to go on an antibiotic and all of a sudden now you have more diarrhea, well, that might be related to the medication that you got for the other condition. So a lot of it is really being a good detective, knowing what your usual side effects are, and then is it just an accentuation of it, or is it something different? And that's where, again, it's really good if you can keep a log on things, especially for medicine, because when you come back to the clinic, we're going to ask, have you tried any new medication? And honestly, we think we're going to remember what they are, but we don't. It's, there's so much going on. It's really good. And then if you at least have a log, oh yeah, I started having this new diarrhea, but oh yeah, I forgot a week before I took that antibiotic, and we know some antibiotics can give you diarrhea, for example. That's sort of the first way we kind of troubleshoot it. What else would you have to say?
Yeah, I always agree, and I didn't mention that. But it's always good to keep a diary, not just a food diary, but it's always good to keep a diary of how you feel. I always suggest to people, especially people with a new diagnosis, write it on your calendar, get a nice book to write in, and every day write down, how do you feel? What are my symptoms today? What are the medications that I'm taking? How are they making me feel? I even sometimes tell people to rate themselves from 1 to 5. 5, I'm having an awesome day. 1, I'm having a really crummy day. And then you can sort of track that over time, and then maybe you got a cold, or maybe we're visiting your grandkids and they were all really sick. And then you can go back and look and say, well, last week, I traveled, I did this, so that it helps us connect the dots too, to kind of tease out, is it the medication that you're on? Is it your pH, or is it something completely separate?
Like, for example, sometimes we've had patients who out of the blue seem to be having more pulmonary hypertension symptoms, and they're on a therapy that's being delivered by a pump, and we realize, oh, something happened to their site, and they didn't realize it, right? And it was like, oh, they weren't getting enough medication because either the site became unattached. I mean, you get the beeping, or there's a lot of scar tissue because they hadn't changed, for example, a romodulin site, they hadn't changed it in 6 weeks, and it was time for them to change. Sometimes it could be that. It very well may be related to our medications, but again, kind of going through systematically, what's different, what are you due for, what are you taking in the background?
I got one last question from online, and then I think we'll have to wrap it up. But the question was, Tylenol and Imodium, are these okay to be taking daily?
It is okay to be taken daily. Usually, especially with selexipag, and that's probably where the question is coming from, where you have those most intense side effects when you initially start the medication or you titrate or you make a dose change, an increase, absolutely, it's okay to take those every day because we're going to hope that those are going to settle down and then you're only going to need it once in a while. Specifically with selexipag or Uptravi, if you are getting those side effects and they're really intense and they never level off and you're taking the Imodium like 6 times a day and you're taking Tylenol around the clock, then Dr. Kemp knows we've gone too far and we need to scale it back.
And just a note for those medicines, it's never good to go beyond 2 grams of Tylenol a day because it can cause liver issues in the long term if you're overusing it. But in the short term, using it as prescribed and not going over, unless you have liver disease, it is safe. And the Imodium, of course, we're causing that diarrhea. So if you read on the box for Imodium, it says if you need to use it beyond a certain number of days, contact your healthcare professional. That's in people who have like infectious diarrhea. That's where it's problematic. We know we're causing diarrhea with many of these medicines. It's okay as long as you don't go past 8 tablets or 16 milligrams a day. But hopefully, like Kelly has said, if it's really a lot, then they're reaching out to us because if we've just bumped up a dose of a medication that causes diarrhea, we may either do it a little more slowly.
Oh, one more. Yep.
Sorry to take, but you didn't talk about oxygen therapy and side effects from that. Are there?
You just
So
repeat the
question
question.
was about oxygen therapy and if there were any side effects. So oxygen is a therapy. We didn't speak specifically about it because it's not a PAH specific. So many people who have heart and lung disease are on oxygen. So, you probably are not being prescribed oxygen unless your oxygen level is low. So it is not safe to have low oxygen levels all the time because that puts more stress on the heart and the lungs and can actually make the pulmonary hypertension worse. So that's why we prescribe it. And usually with the use, like with the help of an oxygen provider, oxygen service company, they'll figure out what the right dose is for you. Most times when people are on oxygen, what becomes problematic is a dry nose because if the oxygen is not being put through sort of bubbled water to give some humidity, it's just the dryness factor with the flow. So one of the things that you can ask is that your provider give you humidity. So like at home in your setup, not in your traveling setup, but at your home setup, it can bubble through oxygen to give it. There's also things you can do on your nose. There's this gel that you can buy called Saccharus gel, and it just forms a bit of a barrier. But oxygen is actually, very useful. Having too much of it isn't as much of a problem in pulmonary hypertension, but of course you want to conserve what you have, particularly when you're traveling. So we don't want you to crank it up. We want the right amount. I don't know if that answers your question. If not, you can come and talk to us after. We'll try and troubleshoot for you.
We're just at time, so I've got to shut it down for today. But I want to thank Dr. Kemp and Kelly for being here. And please feel free to ask them all the rest of your questions throughout the rest of the day. Thank you.